And the most important one, the infrastructure. We have discussed digital, we have discussed AI and technology, but what about infrastructure? So let me invite Dr. Soumitro Chakraborty, who is the CEO of Innovative Project Management Services, one of India's leading project management and CSR advisory firm, whose work spans healthcare, education and community infrastructure projects across the country, including through its foundation CCSE. He brings the builder's view of healthcare, how strategy on paper becomes concrete, equipment and functioning institutions on the ground. Dr. Soumitro.
Thank you, Lokendra. And to begin with, I would like you to, since we are talking about health and lifestyle, there's a small exercise that you can do for Bhanu and his entire team to have organized this. It creates 1 joule of energy and creates a triggering mechanism for mood-enhancing hormones. Please give a big round of applause to the entire CII team for organizing this. You can be louder than this for them. I'm here to basically tell you something about AI and its infrastructural issues that we face right now. But I'm going to begin the entire analogy with a story, and also with a due understanding that I'm a bit under the weather, so I can take a water break if I get stuck in between. So the story starts between 2 children, aged 10 years. One is Vikram, who stays in Lucknow. These are hypothetical stories, which I'm going to come to a synopsis at the end of the day, at the end of my speech. I think Vikram stays in Lucknow and Suresh stays in a remote village in Bundelkhand. Both develop on a given day the same illness. Well, the technology around us here, sitting in this 5-star hotel, seems to be quite great. But the technology around Suresh, who's in the village, is very different. Vikram goes to a hospital in 3 hours. He is diagnosed with the latest technology, including artificial intelligence, wherever applicable, and the latest diagnostic tools available, and he gets medical care, and in a matter of few hours he stabilizes. For the same illness, Suresh's parents first have to figure out where is the nearest PHC. And believe you me, when I say this, I have a lot of impact data to share with you, that the greatest problem in this country today, especially because the majority of the population stays in the rural part of India, is not infrastructure. It is access to infrastructure. So even in UP, in the state of UP, and I've been listening to some of the doyens of the health sector who have been speaking from morning, I still think majority of the states in India suffer from accessibility to health infrastructure. And if you look at the number of deaths, you will realize that about 40% of the deaths, especially in rural India, happen because timely intervention of diagnostic services or healthcare systems don't exist. Now, for example, going with my story, if Suresh has to travel 3 hours or 4 hours to reach to a facility or a PHC, again I would like to highlight, there is overarchingly a lot of data available in India that 70% of our PHCs suffer from specialist sort of not being available at the time when the patient needs a specialist. Roughly our PHCs cater to about, if I am not wrong, somebody can correct me if I am wrong, it is about 35 to 36,000 people. One PHC caters to them, and about 1,65,000 people the CHC caters. But you will find that about there's a deficiency of 70+% of specialists in these CHCs. So one of the concept is when we sit in a 5-star hotel like this and we discuss health, and we go 500 kilometers out of Lucknow and enter into a village, the scenario completely changes. I myself have used wearables coming from technology, how we have taken off. But all these diagnostic services, AI, automation, we talk a lot about it, but we are only centric to one issue, and that is the health services in the urban or the semi-urban space. Yes, internet has or digital intervention has reached to the roots of the society, even to rural parts of India. But has health services also reached with that speed? I think one of the things that when we discuss automation, when we discuss AI intervention, my answer is yes, we need a lot more than where we are today. And I agree with everyone in the panel that yes, we require a lot. The problem is the last person standing at the remotest village in India, how fast is he going to get that service? Whether it is screening, whether it is diagnostic, whether it is health services, when is he going to get it? The data doesn't support that we are reaching at that, we are helping that last man standing on the line. So for me, the greatest discrepancy in this infrastructure come artificial intelligence, come health services debate is the geographic reality and the hindrances that it creates for accessibility to be created and to be enabled for people at the remotest part of this country to get health services. If, for example, imagine today in the morning, Dr. Upasana Arora was sitting here, and I was just thinking while I was also talking to her in the speakers gallery, and I realized what kind of services the hospital is giving. Imagine the similar kind of services extend to the remotest part of this country. We will not be restricted to discussing a lot of projects on PPP mode. In fact, the infrastructure already exists. There is no, if you ask me personally, I don't think there's a lot of requirement of infrastructure. I think there is a lot of requirement of skilled manpower in that infrastructure. And even in the morning we were having a discussion, and I think we need to motivate our current generation to ensure that we are able to create a conducive environment for AI and automation related infrastructures to reach to this and create this last mile connectivity. Because I think that is where the health sector is missing out. And if I can relate a bit, it is similar to the education space, but because the summit is speaking majorly on health, therefore I will restrict to myself to health. So AI can be a great facilitator or a force multiplier when it comes to screening, diagnostics or something. But if you are unable to create a connection between AI, automation, technology and the ASHA worker, and then to the Anganwadi and then take it to the specialist on the BHC and ensure that there is a specialist available not only when a patient is brought, but also when a patient needs it or needs him, I think we will do a world of good. One more thing I think I wanted to focus majorly on is the question and the debate around the world today is artificial intelligence going to replace human beings? Now let me understand and try and talk to you through this and put my point across. I think we are talking about health, and one thing I can guarantee you, how much ever AI you enable and you bring, AI can never replace doctors. AI can never replace nursing staff. You can have robotic surgeries. I heard the robotic surgeries. I think even robotic surgeries are not possible without doctors behind it, right? So I think if we use artificial intelligence or technology as a tool to create an environment where we facilitate doctors for more efficient and optimal use of resources to take the benefits not only in the urban centers, but take it ahead. I'll give you a small example. I think most of us in this room would have heard about telemedicine, right? It's a great concept. But if you look at the telemedicine as a concept and as a service and compare it to the PHC or the CHC intervention in the rural areas of the country, you will understand that there is a huge discrepancy and telemedicine stands no chance today in comparison to the infrastructure that we have with respect to PHCs and CHCs, barring not only in Uttar Pradesh but beyond Uttar Pradesh across the country. Now, Ayushman Bharat did a great job. It created a bridge for a connectivity between the private and the public sector and for an optimal use of the services of the private sector also to be brought in. My question is that we completely alienate a factor that in spite of Ayushman Bharat or projects like that, Majority of Indian rural families are away from poverty only if they're waiting for one health distress. Means I'm all for technology, okay? I myself use a lot of technology. I myself use wearables. I'm always for going ahead with it, and I think technology will reach, we are a 1.46 billion population. If the technology is not connecting to everyone in the country, means we are a great market if we can market ourselves, and we can reach to everyone in the country. That will be a phenomenal achievement for the health sector of any state or the center or the country at large to achieve an optimal result in the sector of health. My only question comes is, even today as I speak, as data as recent as July 2026, nearly 55 million people in a year get into the poverty zone only because of one single health distress. When we talk of technology, when we talk of accessibility, when we talk of so many schemes, I'm not against it, but I get a bit confused. Means you're talking of 55 million people in a every year for a population size of 1.46 billion who are pushed into poverty because of one health distress. I think we need a lot more Ayushman Bharats. I think even Ayushman Bharat should have a component of technology being used. I think the technology and the AI should transcend itself and transit from only urban centers and be taken to the rural areas where we can save a percentage of that 55 million the next year from shifting into poverty. So if we use data and technology to create an insight for creating a need and a necessity of health interventions, it is great. But it is absolutely useless if we only use it for decisions to be taken for urban centers. I think the need of the hour is that to create impact in the sector of health and to ensure that each program, whether public, whether public-private jointly, if it needs to achieve the results that is desired of it, we will have to ensure that discussions today, tomorrow, day after, overall the health sector has to understand that it has to leverage technology, leverage manpower, skill up manpower, and ensure that we are able to take it to the last person standing on the line and save that, and that will be really meaningful for the entire health sector. And thank you all for coming today. I hope the discussion moves from the stage of only talking about technology and infrastructure, and it creates a platform for discussion to create access of healthcare for every single person out of the 1.46 billion people in India. Thank you for listening to me, and once again my heartiest congratulations to the entire CII team for putting this all together. Thank you very much.
Thank you, Dr. Soumitro. I mean, you have nailed the problem. I mean, now the problem statement is there. And as we all know, the resilient healthcare system has got three. It's a triad of technology, infrastructure, and skilled manpower, as you rightly said. If anyone is missing, if skilled manpower is missing, the other two is only a mere decoration. But moving forward with the panel discussion, I mean, I'm going to start with this only, and then because you have heard the speakers, I want engagement from the audience, I mean, learned audience and dignitaries. Last question for Dr. Soumitro, I mean, again is for UP only. UP is building at district scale. We have already started doing that. Medical colleges, critical care blocks, integrated labs. How should the state structure, public, private, and CSR capital, so this infrastructure is operationally sustainable for next 10 years? It has to be sustainable. अगर हमने medical college बनाया है, integrated lab है, या हमारे hub and spoke models हैं, so how public-private relationship? I mean, you have already talked about that. Even the CSR from the companies. So to make it sustainable for next 10 years, it has to be sustainable enough.
So I think I can just speak very briefly on three important points. First is, when you develop a model, let's look at it. So we have a lot of private sector enterprises here sitting. One of the things is, there are two ways you can start a company, and all of you are basically entrepreneurs, are in an entrepreneurial journey. You would realize that there are two important mindsets when you start a company. Either you start a company to operate for a short term, or you start a company to operate for a long term. Every micro decision that you take on a daily basis, whether policy level or execution, you realize that your first marker of whether you started this company for long term or a short term would be determinant of the sequence of decisions that you take. So whatever private-public partnership or whatever models you want to enable, you will have to keep a longer far sight in mind. So having a project, one of the things that becomes a problem is this 5-year election thing. What happens is there's so many elections are always going on. So, and at most of the times when we see that governance structure changes and the prioritization changes to a certain extent, what the distortion, the disruption it brings is in continuity. So if we can develop consensus at a central level and decide that, we will develop a plan for the next 10 years or 15 years for adoption of technology or, skilling manpower or incentivizing manpower to be there for a doctor who has spent 10, 12 years in education should be able to go to a village or a PHC in Bundelkhand and is compensated well enough, taken care of, right? Something that Aviral also spoke about. If that is attractive enough, if we can make that attractive enough, I don't think that, especially in this generation, there is dearth of any kind of patriotism or a need to work for the rural India exists. But I think the vision has to be long term. Two, I think the private sector has to realize that they have a responsibility and they cannot treat that responsibility only as consumers. I think they themselves also have to take responsibility of taking care of the consumers. When you decide that we will take care of our consumers, you will start looking at the social angle of it. And third and the most important, I think the government has to be ready to not only allow policy making to be seamless, but also partnership enabling conducive environment has to be brought up by them. And maybe not this conference, maybe this conference, maybe some closed door roundtables, but we will have to engage with the private sector because they have much more to offer than what is assumed that they are to offer. I think we take private sector for granted to a certain extent. I'm telling my opinion that we call them only for a certain amount of funds or tech to come in, but I think we have to listen. We have to talk to people and listen to the private sector. I think they have a lot to give, and if the government and the private sector is ready, I think you have 1.46 billion consumer base to adopt and that kind of tech.
Yes, I mean, definitely.
Request Dr. Lokendra Gupta to kindly present memento to all our panelists. Mr. Aviral Jain. Mr. Dikshant Gehlot. Dr. Soumitro Chakraborty.